Hi guys, Prab here from ProPhysio Plus. Today we're going to be talking about foot pain in older adults. So please like this video, subscribe to our channel and share with your friends. Alright, let's jump on in. Alright guys, I'm going to talk about a really common foot problem that you may have already experienced in your life, and that's plantar fasciitis. So what is it and why is it caused? Plantar fasciitis occurs due to collagen degeneration of the plantar fascia at the origin, so the calcaneal tuberosity. So if I all the way back, it's usually right at the back of your foot. And as well as the surrounding parafascial structures. And usually what that means is that you get pain in that area, reduced range of movement, especially when you're trying to move your feet up and down, and some swelling in that area as well. And now we're going to jump on into some easy exercises and stretches that you can do to hopefully bring some relief for this condition. So guys, we're going to go through a very simple stretch and an exercise to help with plantar fascia. So Avi, first of all, I'm going to get you to lift up your foot for me. Grab onto your toe and your heel and push it out further, and you should feel a nice stretch down there. So give that a try. So guys, this is a really easy stretch to do to stretch out that plantar fascia in this area as well. You can hold that for about 20 to 30 seconds and do that a couple of times. And the next one we're going to try is a little exercise to get the muscles in your foot activated to offload that little part there that it's inflamed. So very simple, Avi, you're going to try and grab this little piece of rubber with your foot and with your toes, and you're just going to curl them up and lift it up. That's it. And it's almost like you're doing a little bicep curl for your feet. So you can try that 8 to 10 times as well and see how you go with that one. So very simple exercise that you can try at home if you're experiencing plantar fascia.
Hey guys, it's Avi and Prab. So this is going to be a quick fire questions that we get commonly in the clinic regarding foot pain, especially in older adults. So I'm going to kick off the questions. First one is, can your feet grow in your 50s?
So, great question, Avi, and funny enough, it's something that pops up in the clinic once or twice. This is a very common theme that occurs, and you can definitely feel like you go up in size with your footwear. But that does not mean that your bones or length of feet have grown, but rather the fatty padding on your soles of your feet has decreased a considerable amount. Also, in part because of weight gain that could put additional pressure on your feet. And this can also lead to increased fluid in your feet, and which leads to a change in size. The ligaments and tendons sometimes lose their elasticity over time, which can also predispose people to potentially having painful ruptures or micro tears in the future. This can lead to your feet getting flatter and wider over time. And a common case of this is during pregnancy, where your foot size can grow due to the hormone relaxin, which is responsible for helping to soften and loosen your ligaments and tissues.
Cool, perfect. Thanks for that answer. Question number 2, what does arthritis in the foot look like?
Yeah, so definitely arthritis in the foot is quite common, and it's becoming a bigger and bigger issue in this current generation. As you get older, you definitely have a higher risk of arthritis. The joint damage from this condition can cause swelling, pain, and physical changes in your feet and ankles. So you slowly lose a smooth cushioning cartilage inside them. And as a result of this, your bones rub and wear against each other, and soft tissues in your joints also may begin to wear down. Commonly, this will make it difficult to transfer weight onto your foot, especially when moving in activities such as walking. There'll be more pain and swelling after you rest, such as first thing in the morning and also at night time. Joint stiffness and warmth can also be noted, which can make it very difficult to move and restrict movement patterns on a daily basis.
Thanks for that answer. So this is another question similar to what you touched on about arthritis, but what are causes of foot pain, especially in old age?
As mentioned before, a lot of things such as aging, fat pad stiffness, and slow recovery can definitely lead to foot pain. However, foot pain can also be caused and is usually classified into 2 primary categories. There's a great article by this great researcher called Menz in 2016 that explored this a little bit further. So conditions caused by local factors and conditions caused by systemic factors are these 2 categories. And local factors can include structural disorders that affect the load-bearing function of the foot, and systemic factors include dermatological, vascular, neurological, and musculoskeletal conditions that could manifest in the foot. In addition to this, there's also a lot of predisposing factors that can both cause foot pain in older people. Many studies have shown that factors such as, the sex that you are, male or female, obesity, depression, diabetes, and osteoarthritis, all being contributing factors to developing foot pain with age. Further, being female and having osteoarthritis were definitely shown to have the strongest association with foot pain in the future.
All right, thanks for that question. So women, just watch out. Maybe it could be the footwear you're wearing, potentially.
Definitely.
The heels.
Oh yeah, big bad one.
All right, so how do you treat aging feet?
So, it's a big question, because how can you take care of your feet as you get older? Taking care of your feet when you're getting older is so important, because when your feet aren't working right, this could mean that you could lead to a fall, immobility, and progression of frailty, and of course that leads to greater levels of dependency, which you don't want when you get older. It's also important to note that you definitely have to consider the impact of all the strategies that were used to manage foot pain and care, especially when you're getting older, as you never know what thing may work for you best. So therefore, it's really important to consult a podiatrist, physiotherapist, or a relevant healthcare professional before undertaking any new treatments. And here's some things that definitely have been shown to help with aging feet that you can try at home if you like. First of all, getting a regular checkup with a healthcare professional. Signs of deterioration or certain conditions associated with a foot can be very subtle. Therefore, getting it checked out by the relevant professional is the best way to go forward, because they can pick up on things that you might not see that could be very, very big and have a big impact on your life in the future. Secondly, nails, guys. Having a good set of nails on you and maintaining that in the future is really, really important, as poorly maintained nails can very easily become ingrown, which can lead to a lot of pain and immobility in the future. Thirdly, your skin quality. You moisturize your face every single day. It's important to moisturize your feet as well. Why? Dry and cracked skin can lead to sores, which are areas that are rife with bacteria, and cellulitis, which is a bacterial skin infection, is very common in elderly people and often reoccurs. So therefore, good skin hygiene, guys, number one thing to be mindful of. And lastly, like Avi mentioned, your footwear. Ladies, the heels sometimes may have to go. A good pair of close heel flat shoes with good shock absorption promotes really good walking posture and balance, which will definitely reduce any risk of chafing or rubbing in the feet in the future. And further, it can definitely help joints and soft tissues in the foot to work properly.
All right, thanks for that, Prab. That was some very thorough answers on the quickfire questions. So remember, making healthy simple, and hope you enjoyed that video. Cheers.